patient had a set of bite wings done in your practice, and your hygienist noticed an abnormality on the lower right, a dark shadow, obvious bone loss, or infection. She knows the doctor is on her way in for the exam. There are two primary reactions that usually happen in that moment. She can say nothing and spring this finding on everyone when the doctor walks in, or she can say something like this: "Mrs. Smith, I see something on this x-ray concerning me about this tooth. I want to make sure that Dr. Jones takes a look at that, so I'll make her aware of it when she comes in to see you in a few minutes." Which way would that be handled in your practice? What would that three-way communication between hygienist, doctor, and the patient look like? And most importantly, how often do you work on this critical moment you face every day? Here's another scenario. A nervous patient is walking up front, turns, and says to the assistant or the admin team member, "Do I really need this crown?" Would everyone be able to answer that spontaneous question? In those moments, those answers speak volumes about your practice. This is where clarity, trust, and potential case acceptance are won or lost. That's why the restorative partnership is critically important in your dental practice. The restorative partnership is the way your team collectively understands what you do and how you communicate it between yourself and patients to create a better understanding of the treatment. This is where the internal study club comes in. Your internal study club is a perfect use of the 30 minutes of system development time in your staff meeting. The purpose of this is for the doctor to clarify the following: how she diagnoses, exactly what language she uses, and the specific diagnostic tools and records she includes during these conversations with patients. The goal here is twofold. First, you'll want to calibrate the language you use around patients. For example, if the doctor uses the term swelling and bleeding, the entire staff should be using swelling and bleeding. If the doctor uses inflammation and bleeding, you'll all want to use that same verbiage. The result? The patient will hear, accept, and trust the diagnosis when we're using the same language. The second goal is simply to educate your entire staff. The more knowledgeable of your dentistry, the better you can help patients understand it. When I was a treatment coordinator, I realized I could single-handedly boost our case acceptance rate once I understood the diagnosis the doctor was making. When faced with a patient hesitant about moving forward with a crown, I could clearly explain that I understood the decay is deeply rooted in the tooth. I might say, "If we don't take care of it now, Mrs. Smith, it may get beyond the need for just a crown and ultimately require a root canal and a crown, and that would cost an additional $1,300 in our office. If we're proactive and take care of it now, you will save money, avoid pain, and spare yourself a more invasive procedure." When the entire team can gain that insight, we all have the power to talk about dentistry and potentially boost case acceptance. So your internal study club is about to start. Doctor, you'll bring a specific case to the team meeting. Let's say the diagnosis was 2 crowns and a filling on the upper right. Bring every piece you'd use in that diagnostic conversation with the patient. Starting with intraoral photos and x-rays, the doctor will stand before the team and say, "Here's what I see. See the dark shadowing? Or that overhang? Those are the things that concern me." Next, the doctor will go through the clinical notes made for that patient. I've noted here that there's deep decay. The doctor might even explain the specific instruments used in the diagnosis. Finally, the doctor will demonstrate how he explained this to the patient, include the specific clinical language. The idea here is to pretend like the patient is in the room and the doctor goes through the diagnosis so everyone can see, hear, and possibly even touch what the doctor did in those moments. This is where you will calibrate and make sure everyone understands the language that you use with patients. That's how you run your internal study club. Leave time for questions and opportunities to gain more clarity among your staff members. Remember, in any study club, there are no bad questions, there are only bad answers. When a nervous patient asks, "Why?" those answers simply can't be, "I don't know," or "Let me go check." An internal study club will give your team the confidence they need to answer those questions in the moment. So the compass points for strengthening your restorative partnership: recognize everyone employed in your practice must understand why you do what you do. Periodically use 30 minutes of a team meeting to hold your internal study club, where the doctor brings a case with x-rays, photos, notes, and instruments used in the diagnosis and explanation to the patient. Decide what terms you're going to use when explaining swelling, inflammation, occlusion. Use them consistently to cement your patient's understanding of everything going on in their mouths. To help you, we've included a list of terms that might be more easily understood by your patients. Bring that list to your first internal study club. By doing this exercise together, when a patient asks why, you'll have the immediate answer and language that builds understanding, trust, and willingness to move forward with treatment.